Today, we're going to talk about semaglutide after bariatric surgery. So this is not an uncommon question we get. So today, we're going to talk a little bit about that. So if you don't know, semaglutide is a newer medication in the class, a medication called GLP-1 agonist. And essentially what that means is a medication that targets certain receptors in your body, mostly on the GI tract. One of the things it's going to do is help your insulin be more sensitive. And also it's going to decrease how much glucose your body creates on its own. Another one of the effects is, probably the main effect, is that's going to decrease your appetite. Now, semaglutide is sometimes prescribed after bariatric surgery. Typically, we use it if when the person's plateauing or gaining weight, or if they essentially have failed the bypass, meaning either they did not lose or they failed the surgery, so either they did not lose much weight or they regained the weight that they had lost. And so in these patients, they can be used for an extended period to help maintain weight loss. So one of the benefits is with the weight loss is we get less of the secondary conditions we're concerned about, primarily high blood pressure, worsening diabetes, or becoming diabetic, and heart disease. So in fact, there have actually been multiple studies on this, but one study in particular looked at semaglutide or Ozempic at the 1 milligram dose versus another medication in that class called liraglutide. That medication had previously been approved for weight loss and it was used often in patients who had a bariatric surgery. In the study, the people were either given liraglutide, which is known to work in these patients, or semaglutide, the 1 milligram dose. The types of surgeries were not all the same. Most of the patients in the study had what's called a gastric sleeve. This is a surgically implanted device that will increase the size of your stomach. Another subset of patients had what's called a gastric bypass, which is a surgical procedure where essentially we're making the stomach much smaller. And another percent had what's called a gastric lap band. And so this is a small device that's placed surgically as well that will decrease the size of the stomach and is adjustable. So they follow these people over a year. Essentially, the people who use semaglutide had a much higher weight loss, about 13.4% compared to 11 in the liraglutide group. Also, they had a higher percentage of people who lost 10% or more in the semaglutide group as well. So that said, it did work quite well for people who've had a gastric bypass, though particularly we're not even at the max dose of this medication. Also, the side effects were similar. Semaglutide can be used in people, so in short, people who had bariatric surgery, either a gastric bypass, lap band, or gastric sleeve, can use this medication and see results. If this is something you might be interested in, talk to your provider, see if it's an option for you. If you found this helpful, please subscribe or like the video. If you want to learn more about other weight loss medications, check out one of these videos.